Hello and welcome to the third and final module in the chapter Addressing Violence in the MSM Implementation Toolkit, or MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men, and HIV. In this third module of the chapter, titled Promising Interventions and Monitoring and Evaluation, we continue to look at promising anti-violence interventions and discuss monitoring and evaluation with these interventions in mind. After completing this module, you should have a basic understanding of 1. Examples of promising interventions that address violence, and 2. Issues relating to the monitoring of anti-violence interventions. With these goals in mind, let's begin. In the second module of this chapter, we looked at the contexts and conditions that enable violence. In this module, we will look in depth at more promising ways to address violence. To refresh your memory, they are presented here. We left off in the last module with promoting safety and security. We will now turn our attention towards the provision of health services. Medical care is an important component of anti-violence initiatives. Men who have sex with men who experience physical, sexual and psychological violence may need medical care in both the short and long term. In most settings, there are few, if any, specialised medical services for those who experience violence. The point of entry to immediate health care may be through the emergency services, so wherever possible, emergency service providers should be trained and sensitised in appropriate provision of emergency care to men who have sex with men who experience violence. For longer-term care, it may be useful to consider integrating services into the broader set of HIV prevention, treatment and care, and other health services for men who have sex with men. Crisis response teams can increase the sense of security and confidence of men who have sex with men, and increase uptake of HIV-related services. Longer-term approaches, such as media campaigns, can also be planned in conjunction with the programme's advocacy team. Training in these types of activities may be led by knowledgeable men who have sex with men, may cover listening and communication skills, prioritising the safety of men who have sex with men, advocacy skills to work with the police, social and health services and media, knowledge of the rights of men who have sex with men, dealing with police and local government officials, counselling those who may be under psychological duress, and assessing risks of harm. Training should take into account different learning needs and the diversity, e.g. ethnicity, migrant status, of gay, bisexual and other men who have sex with men. This may require engaging or linking with lawyers or trained paralegals, who may themselves be community members, who can help negotiate with legal and judicial authorities about incidents of violence, advocate on behalf of men who have sex with men, and support training on laws related to homosexuality. Support service models vary in terms of their complexity, the amount of financial and human resources required to operate them, and whether they have been evaluated and shown to work. Support services should also be based on assessments of informal practices already established by men who have sex with men themselves, and on their existing priorities. Some models, such as comprehensive crisis response systems, are resource-intensive, while others may require fewer resources. Additionally, there are other services that can assist in addressing violence against gay, bisexual, and other men who have sex with men. These include 1. Providing necessary infrastructure. This may include local mobile phone numbers and/or hotlines staffed by trained community members. The availability of support services may need to be advertised through word of mouth, flyers, and other communication channels. 2. Documenting incidents of violence. Recording incidents of violence enables program staff to analyse the incidents, ensure follow-up, monitor efforts and improve services. For men who have sex with men who want to file legal cases in response to violence, such documentation helps to provide necessary evidence for courts. Data on violence faced by men who have sex with men may also be used for advocacy with local, state and national policymakers, and for planning services to address violence against men who have sex with men. The interventions described here are not only implemented at a local level, but also require engagement at subnational and national levels. This is particularly true for sensitisation and advocacy. It should be noted that in many contexts, specific interventions may be required across multiple levels. Monitoring and evaluation of violence prevention and response efforts are important because data on the specific forms of violence faced by men who have sex with men and the context in which they occur provide a basis for planning and designing appropriate strategies. Including indicators on violence faced by men who have sex with men in the routine monitoring framework allows programs to monitor whether there are any unintended consequences of programs and interventions, e.g., backlash violence. And evidence of violence faced by men who have sex with men is a powerful tool for advocacy efforts to change laws and policies related to homosexuality and create an enabling environment for gay, bisexual and other men who have sex with men. There are currently no validated and internationally agreed upon population-based impact indicators or programmatic indicators that are specific to violence faced by men who have sex with men. Indicators for monitoring and evaluating interventions that address violence against men who have sex with men may be developed or adapted and validated based on existing indicators for women. In India, for example, where the Advan AIDS initiative included crisis response systems to address violence, programs have also collected data on reporting incidents of violence faced by men who have sex with men. These indicators include number of men who have sex with men who report incidents of physical violence, number of men who have sex with men who report incidents of sexual violence, and perpetrators of any violence reported by men who have sex with men by category, e.g., police, intimate partner, client. There are several issues with data collection regarding gay, bisexual and other men who have sex with men. These include gathering accurate information about violence requires that MSM be comfortable disclosing their experiences of violence. In contexts where same-sex sexual behaviour is highly stigmatised or criminalised, gaining trust takes time and requires consistent integrity, respect and honesty in relationships with men who have sex with men. Collecting data should not further endanger the safety of men who have sex with men or stigmatise them, and MSM must be equal partners in the design, implementation and dissemination of results from data collection related to violence and other human rights violations. Before moving on, please consider the questions presented in this self-check and assess your understanding. Which of the following would not be considered an issue in collecting accurate information about MSM who experience violence? A. Gaining trust will require time, consistency, respect and honesty regarding talking about relationships with men who have sex with men. B. Men who have sex with men tend to exaggerate their experiences with violence. C. Collecting data should not further endanger the safety of men who have sex with men or stigmatise them. D. MSM must be equal partners in the design, implementation and dissemination of results from data collection related to violence and other human rights violations. The correct answer is B. We should never question the legitimacy of experiences of violence against men who have sex with men. This third module brings us to the end of the chapter on addressing violence in the MSMIT. To review, in this module, we have continued outlining promising interventions across a number of contexts for addressing violence, as well as issues to consider when monitoring and evaluating such interventions. Congratulations, you made it! We encourage you to continue learning and explore the other chapters in this tool.